Hi, I'm Natalie. I'm in my first year of college studying health and social care. Today I'll be presenting a PowerPoint about safeguarding in health and social. So let's get started. So what is safeguarding? Safeguarding means to prevent harm from being inflicted on individuals. Safeguarding establishes a protected and accepting space for everyone. Both adults and children should be safeguarded. Safeguarding helps to promote an individual's safety, freedom, protection, welfare, and their independence. It's important that those who need protection from harm are provided with services to help them. It is everyone's responsibility to safeguard. Effective safeguarding of both children and adults cannot be done by one service alone. Everyone must work together. It's important to safeguard all individuals because anyone can be exposed to harm, and it's important that we undertake a duty of care to protect them. Safeguarding should be approached differently for all individuals. For example, safeguarding adults and children will be different. In all environments, safeguarding is a fundamental aspect of care. Safeguarding should be prioritised in health and social care. It ensures high-quality health and social care services. Safeguarding principles. Children and adults safeguarding are underpinned by several principles that should be followed by practitioners. When safeguarding adults, there are 6 principles that should be acknowledged and followed: empowerment, prevention, proportionality, protection, partnership, and accountability. There are 2 safeguarding principles for children. The first is safeguarding is everyone's responsibility. Those who work with children are obliged to safeguard them. The second encourages a child-centred approach. This means making decisions in the best interest of the child, as well as listening to their own views and approaches. I'm going to talk a bit about types of abuse. There's physical, sexual, financial, neglect, emotional or psychological, self-neglect, discriminatory, domestic, institutional, and finally, modern slavery. There are 10 different forms of abuse, and I'm going to explain a few of them now. So physical abuse is being pushed, shaken, pinched, hit, held down, locked in a room, restrained inappropriately, or knowingly giving a person too much or not enough medication. Financial abuse is misusing or stealing a person's money or belongings. This includes fraud, postal or internet scams, and tricking people out of money, or pressuring a person into making decisions about their financial affairs, including decisions involving wills and property. Self-neglect is when a person is unable or unwilling to care for their own essential needs. This includes their health or surroundings. For example, their home could be unclean, they could refuse necessary support, or be obsessively hoarding. Abuse can happen in any environment, so it's important that employers in health and social care can recognise early signs of abuse so to prevent escalating of further problems. This is important because any individual can abuse another. Care home employees, nursery employees, and teachers specifically safeguard as part of their job. These workers must follow specific guidelines regarding safeguarding policies and procedures. They offer information about how to handle abuse concerns. For example, safeguarding an elderly person who is living alone will be accomplished by providing care workers to support them. They may also need the support from close friends and family members to ensure abuse and neglect is avoided. Safeguarding is significant in all areas of work, specifically in health and social care. Vulnerability. Vulnerability means being exposed to dangers. These can be physical, emotional, or mentally harming on the targeted individual. Individuals which are vulnerable tend to be unable to care for themselves, so are under the care of others, which can expose them to the risk of being harmed or abused. Many factors which can cause vulnerability include disability, age, isolation, children which are looked after, social media, mental ill health, internet, substance abuse, domestic abuse, physical health, youth offenders, cognitive impairment, and many more. Safeguarding ensures that those who are susceptible to harm or abuse due to their vulnerability are properly cared for. Those who safeguard should be aware of vulnerability factors so individuals are kept safe. So now I'm going to talk about some factors that make individuals more vulnerable. The first one is social media. In regards to social media, teenagers tend to be the vulnerable individuals. They're the targeted audience for social media platforms, so many problems occur within their age group. There are many dangers online which can put individuals at risk. This includes online grooming, online bullying, bad mental health and self-esteem or lack of it, and catfishing as well. I'm going to talk a little bit about mental ill health. This is largely impactful on the risk of individuals. Specifically, it affects people with dementia alongside other conditions. This is because of their tendency to forget details of events which have occurred, so they can be easily taken advantage of. Those with mental ill health may find themselves defenceless in scenarios where they are in danger. This is particularly harmful to those who have limited mobility. These things make individuals with mental ill health prone to harm or abuse. Health and social care practitioners should be aware of the factors that can make an individual more vulnerable to harm and abuse, because they are usually working frontline with vulnerable children and adults, so they will be some of the first people to pick up on any concerns. Also, knowing if a person is more vulnerable can make practitioners extra vigilant and allows them to be aware of and look out for signs and symptoms. Finally, practitioners can put plans in place to minimise the potential risks of people who are more vulnerable. So that concludes my PowerPoint, and thank you for listening.